Okay, thanks very much. Welcome, everyone. Thanks very much for coming along today, and I'm hoping you're going to find this afternoon an enjoyable and informative event. So this is the National Institute for Health Research, NIHR's Applied Research Collaborations, ARCs, national program, priority program in healthy aging, dementia, and frailty. So the national priority program, is basically a collaboration between a number of the ARCs in England, ourselves in Greater Manchester, ARC Wessex, ARC in Yorkshire and Humber, and Southwestern Peninsula came together and bid for some funding from NIHR a few years ago to lead this priority program. And we've funded a number of studies which are kicking off or have kicked off within the last few months across the country. And we've also doing a number of these workshops in different areas, which were decided that would be kind of important to be able to share as shared learning events across colleagues across the various ARCs and other parts of the NIHR's infrastructure. So the three projects that we've got currently ongoing there's a project called the Flexi project, which is on Falls Management Exercise Programme, which is led by ARC East Midlands, with ourselves in Greater Manchester and the Southwest Peninsula ARC. That's looking at the falls prevention programme and rolling it out, implementing it. Then there's the WHEELED programme, which is a training care home staff to improve wellbeing and mental health of dementia patients, and that's led by ARC Peninsula, working with ARC South London, East Midlands, East of England, East and North Cumbria, and North West Coast, and Yorkshire and Humber. So quite a large number of the ARCs taking part in that. And the third project that we're funding is the Finch programme, which is a falls prevention and care home programme, being led by ARC East Midlands with Northeast, North Cumbria Coast, West Midlands and South London. So as you can see, these programmes as a national priority cover pretty much most of the country, and by the country, of course, I'm talking about England rather than the evolved nations, but most of the country are taking part in one or more of our ongoing projects. We've got a series of 4 of these different workshops between now and June. I would have liked to be able to say to you exactly when the dates are, but not all of the dates have yet been set. But the programs are today's workshop on basically meeting the needs of commissioners, policymakers, and academic health science networks, and the rollout program. So we've got a number of very interesting speakers who will be speaking soon. But in the future, there's one on workforce development for the ageing population. And we have got a date for that, which is the 26th of April. And then there'll be economics for ageing research. So looking at economic methods, which are not just the standard health economic approaches to cost benefit. That'll be during the week commencing the 22nd of May, probably the 26th or 27th. And then we've got one on patient and public involvement being led by Penn ARC, which I think is going to be in June, but we don't actually have a perfect date for that yet. Okay, so that's what we are as a national priority program and what we're doing. I've got a few housekeeping points to make before we then kick off into today's program.